Alere, knowing now matters. The Alere Determine HIV 1-2 antigen antibody combo test procedure for fingerstick whole blood samples. The Alere Determine HIV 1-2 antigen antibody combo is an immunochromatographic test for the simultaneous and separate qualitative detection of free non-immunocomplexed HIV-1 P24 antigen and antibodies to HIV-1 and HIV-2 in human blood. Any modification by the laboratory to the Alere Determine HIV 1-2 antigen antibody combo test or the FDA-approved Alere Determine HIV 1-2 antigen antibody combo test instructions will result in the test no longer meeting the requirements for waived category. A CLIA certificate of waiver is required to perform the test in a waived setting. Additional CLIA waiver information is available at the Centers for Medicare and Medicaid website at www.cms.hhs.gov/CLIA or from your state health department. Test kit components. Each Alere Determine HIV 1-2 antigen antibody combo kit contains 1 aluminum Ziploc pouch containing either 5 test cards with 25 test units or 10 test cards with 100 test units, a desiccant package, chase buffer, a quick reference guide, package insert, subject information notices, a customer letter, disposable capillary tubes for collection and transfer of fingerstick samples, and disposable workstations. Materials required and available as an accessory to the test kit. Alere Determine HIV 1-2 antigen antibody combo controls. Materials required but not provided. To perform the test with fingerstick whole blood specimen, you will need a timing device, a sterile lancet capable of producing 50 microliters of blood, disposable gloves, sterile gauze, antiseptic wipes, and a biohazard disposal container. Test and sample storage requirements. The test kit and chase buffer must be stored at 2 to 30 degrees Celsius or 36 to 86 degrees Fahrenheit. Whole blood collected by fingerstick should be tested immediately. Test preparation. Open the aluminum pouch containing the Alere Determine HIV 1-2 antigen antibody combo cards. Remove the desired number of test units from the 5 or 10 test unit card by bending and tearing at the perforation. Removal of the test units should start from the right side of the card to preserve the lot number, which appears on the left side of the card. Return the unused test units to the aluminum pouch and close the pouch with a Ziploc. Store the unused cards and test units only in the aluminum pouch containing the desiccant package. Carefully close the Ziploc so that the cards are not exposed to ambient humidity during storage. Remove the protective foil cover from each test unit. Lay the test unit flat in the workstation. The test should be initiated within 2 hours after removing the protective foil cover from each test unit. Do not touch the sample pad with your fingers. Use of the workstation is optional. If the workstation is not used, place the test unit on a flat surface. Fingerstick preparation. Optimize blood flow prior to collection. Warm the hand by washing the hand in warm water or holding it in a heating pad or hand warmer for a couple of minutes. Lower the hand below the heart level before collecting a drop of blood. Massage the finger with a downward motion several times before performing the fingerstick. Test procedure. Collect fingerstick sample using the capillary tube. Caution: the capillary tube must be used to collect the fingerstick sample. Clean the finger of the person being tested with an antiseptic wipe. Allow the finger to dry thoroughly or wipe dry with a sterile gauze pad. Using a sterile lancet capable of producing 50 microliters of blood, puncture the skin just off the center of the finger pad and wipe away the first drop with sterile gauze. To collect an adequate sample volume, quickly express blood down the fingertip by gently squeezing across the entire finger to the last joint, not to the end of the fingertip. Collect the second drop of blood by holding the capillary tube horizontally and touch the tip of the capillary tube to the blood sample. Filling of the capillary is automatic. Do not squeeze the bulb while sampling. Maintain this position until the flow of the sample has reached the fill line and stopped. Adding the fingerstick sample to the sample pad. Touch the tip of the capillary tube containing the blood sample to the sample pad and expel all of the contents by gently squeezing the bulb. When all of the blood is transferred to the sample pad, wait 1 minute to ensure the chase buffer does not overflow the sample pad, and then add 1 drop of chase buffer to the sample pad. Caution: do not lift the capillary tube from the sample pad before all the blood has been transferred. A bubble may form which will prevent the complete transfer of sample. If a sample won't expel, cover the small opening at the mark on the capillary with a gloved finger. Then squeeze the bulb until the sample is fully dispensed onto the sample pad. Only the liquid provided in the chase buffer bottle should be used. Do not use water or other liquids. Read the test result between 20 and 30 minutes after the addition of the chase buffer. Do not read the results after 30 minutes. Discard the used capillary tube, test unit, and any other test material into a biohazard waste container. Interpretation of results. Antibody reactive. 2 lines, control line and antibody line. A pink-red control line appears in the control area, and a pink-red antibody line must appear in the lower test area of the test unit. The intensity of the antibody and control lines may vary. Any visible pink-red color in both the control and lower test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 and/or HIV-2 antibodies have been detected in the specimen. The test result is interpreted as preliminary positive for HIV-1 and/or HIV-2 antibodies. Antigen reactive. 2 lines, control line and antigen line. A pink-red control line appears in the control area, and a pink-red antigen line must appear in the upper test area of the test unit. The intensity of the antigen and control lines may vary. Any visible pink-red color in both the control and upper test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1p24 antigen has been detected in the specimen. The test result is interpreted as preliminary positive for HIV-1p24 antigen. A test result that is preliminary positive for HIV-1p24 antigen in the absence of reactivity for HIV-1 or HIV-2 antibodies may indicate an acute HIV-1 infection in the test subject. In this case, the acute HIV-1 infection is distinguished from an established HIV-1 infection in which antibodies to HIV-1 are present. Antibody and antigen reactive. 3 lines, control, antibody, and antigen line. A pink-red control line appears in the control area, and a pink-red antibody line must appear in the lower test area, and a pink-red antigen line appears in the upper test area of the test unit. The intensity of the antibody, antigen, and control lines may vary. Any visible pink-red color in the control area, the lower test area, and the upper test area, regardless of intensity, is considered reactive. The test result is interpreted as preliminary positive for HIV-1 and/or HIV-2 antibodies and HIV-1p24 antigen. Non-reactive result. 1 line, control line. A pink-red control line appears in the control area of the test unit, and no pink-red antibody or antigen line appears in the lower test area and the upper test area of the test unit, respectively. A non-reactive test result means that HIV-1 or HIV-2 antibodies and HIV-1p24 antigen were not detected in the specimen. Invalid result. No control line. If there is no pink-red control line in the control area of the test unit, even if a pink-red line appears in the lower test area, or the upper test area of the test unit. The result is invalid and the test should be repeated. If the problem persists, contact Alere technical support. The Alere Determine HIV 1-2 Antigen Antibody Combo Test Kit, detecting HIV earlier at the point of care than ever before. The first and only FDA-approved rapid point-of-care test that detects both HIV-1 and HIV-2 antibodies, as well as free HIV-1 P24 antigen. A fourth-generation rapid test with the ability to identify HIV earlier than second- and third-generation antibody-only tests. This enables healthcare providers to diagnose HIV infection earlier, allowing individuals to seek medical care sooner. For more information, please visit alerehiv.com/US.